Okay. What is good about lunch or break or breakfast or break is that people feed themselves and they return happy. What is bad is that to keep your attention after you have eaten, it's more difficult for me. So normally people take a little bit longer to come into the room again. But all right, we are going to start. No, it's working. We, Professor Carlos Aceves and myself, I am Yordan Rodríguez, we did a joint project, research work 2 months ago, and we started to prepare this conference, specifically focused to human factors and ergonomics in pharmacovigilance. And before starting my presentation, I want to leave clear just one thing. Human factors is the same as ergonomics. Human factors is the same as ergonomics. That's why normally it's called human factors and ergonomics. What this means that whenever we refer to ergonomics, we are talking about human factors at the same time. And whenever I mention human factors, I'm referring to ergonomics. They're exactly the same. I'm telling you this because normally some areas have heard human factors, other areas hear ergonomics, but they are exactly the same. So let's start. Pasa o no pasa? Yeah, it's pasa. My presentation it will be by the two of us, and it is this definition. That's the definition being used globally. It says that ergonomics or human factors is a scientific discipline. Yeah, it's considered a scientific discipline that is in understanding the interaction of humans with other elements of the system. And so, what is the intention of ergonomics? One, to provide welfare and to increase the performance of the system. That is, for things to be more efficient, that tasks are committed, take place in a shorter period of time, less mistakes. Welfare and these two things. And this is represented in the slide. You can see that ergonomics, when you adjust the system and you design that in function of the characteristics of the person, two things are obtained. Welfare, well-being, that is better health, satisfaction, safety, and at the same time better productivity, efficiency, reduction of mistakes, etc. In other words, performance. That duality of ergonomics, of looking at these two goals or objectives, is what differentiates ergonomics from other areas. Engineering, for instance, is looking to improve efficiency. Medicine is looking to improve health. Ergonomics looks for the two things, and one of the differential factors with other scientific disciplines is because of this. Therefore, what ergonomists do, the practitioners that dedicate to human factors and ergonomics, we design and assess the tasks, products, environments, and systems to make them compatible with the needs and skills of human beings. Surely, many of you, when you have gone out to the recess room, you see men and women, and the difference is minimum. Maybe one of you, when you're going in, you need to think. Maybe you have committed a mistake. You are going to the ladies' room. So, that is because ergonomics principles were not considered, because if you see that easily, you won't be wrong, and we will see that when it's applied to pharmacovigilance and erroneous prescription. This is one of my favorite slides. It simplifies the essence of what we want to transmit with ergonomics. We have there two cows, and what they are doing, these two cows, is to wait for the phone to ring. The phone rings, but cows, maybe you know, doesn't have fingers. They have claws, or they cannot pick an object because they don't have a way of doing it because they don't have fingers. So from the technical point of view, the phone is ringing perfectly, working perfectly, but because it did not consider the characteristics and limitations of the users, in this case the cows, means that they cannot use that phone. It may ring and they cannot answer it. So this is the practice that defends and promotes ergonomics. This is the founding principle. We always need to think in the user and what to do so that user can use the best way possible the products and perform the task, etc. This slide somehow simplifies the applicability of ergonomics in our organization. It goes from how we design the different tools, or whatever tool that is being used in the health area, industry, or in our daily life, up to how we design an entire organization, going from equipment, environment, education, training. There is a micro environment up to a micro environment. There are three domains recognized in ergonomics. We're talking about physical ergonomics, that is the one you may have heard. Human factors and ergonomics, and the physical environment has to do with the furniture, tables, chairs, the force that we apply, the design of space. That's the domain of physical ergonomics. Cognitive ergonomics has to do with mental processes, how persons think and process the information, and how we need to design the different products, the interfaces of medical devices, for instance, or mobile phones, or web pages, utensils, and tools. Because it needs to consider how human beings think, and under that logic, cognitive ergonomics apply the same principle for the design and assessments of cognitive aspects, that is, objects with the human being interact. And finally, we can talk about organization ergonomics, or macroeconomics. Has to do with how we optimize the social technical system. We see the organization as a whole. There, persons interact with technological tools, how to see that it's optimized. Communication is included here, how to make effective communication, how to do a proper teamwork, how to work well in shifts. This is deal with in organizational economics. So what is system ergonomics? This is a key message I want you to tell me. Economics is not cognitive, physical. Economics really apply, and I think that's the big difference from other disciplines, apply under the focus of a system. That means that it integrates and see hints in a holistic way. We will see in the cases that will be shown to you at the end of the presentation, we will see there how when a person is wrong or there's a mistaken medication, there are many factors that come into place, physical, cognitive, etc., that provoke that situation. And it's not the person, because regardless of the person, it may happen if the conditions are the right ones, ergonomic-wise. This is one of the most interesting characteristics of ergonomics that I feel very well in this Congress, and I've been asked always, me being an industrial engineer, what I'm doing in a pharmacovigilance Congress, where most of you, 80% or 90%, are healthcare professionals. And I'm to explain the fundamental reason why I'm here. Ergonomics does not leave anybody outside. It includes everybody. Economics of organization, economics of engineering, economics of psychology, of social sciences, of design. In other words, ergonomics, and the main characteristics of it, is that it has an integrated, holistic view that considers the principle, the knowledge of other disciplines, and apply that to improve the well-being and improve the performance of the entire system. Here you will see this slide. I like this as well. That is gold. That there's a teacher from the United Kingdom that it was given to us. We are using that because it's not I must recognize it's not I must give the credit. But this is quite interesting. Look at this. Each discipline, each one of you see the phenomenon from certain point of view. Doctors, engineers, pharmaceutical, pharmacists, biologists, they all have their own point of view. The designers have their own point of view. And at the end, we see this is a rope. This one said this is a tree. There's one that is touching the. It says there is a tool, and the one on top, this is a fan. So you can see how each discipline has a different insight, a different interpretation of depending how he sees the system. Professional of ergonomics see this as a whole, as a system. Therefore, that is the vision, the view that is being promoted. To be a professional in ergonomics, you need to know about engineering, you need to know about organizational aspects, anatomy, if you will, many aspects, because it's the only way we have to understand the system and be able to design in function of the characteristics of the persons that are going to live or work in that system. I want to emphasize in two, maybe you can read the rest, but I want it changes a little bit the conception we have of ergonomics and human factors. What is fiction? Something that we have preconceived in our mind. Economics and human factors focus only on individuals. Now, the view is not human factors are not only on individuals. They concentrate on from individual and up to the organization. If we are not capable of seeing that like that, I can tell you honestly, we can be in many Congress, but we will never be able to prevent medication errors and other problems that have to do with patient safety, among many that take place in the healthcare system. We need to have a broad, holistic view. It's the only way of solving this problem that is quite complex. And the other aspect I want to highlight here, human factors focus on how to modify the behavior of persons. No, wrong. Human factors are concentrated on how to design the systems, considering how the people think, how do they react. That's what human factors is all about. And this I incorporated from this idea I discussed with Carlos. For you to see how in the Colombian context, we have a survey about this. We sent this away to 116 of public hospitals in the department of Antioquia, one of the provinces of Colombia, one of the second most important one. The first one is Bogotá, where we are right now. So it was sent to 117 public hospitals, and out of those 117 hospitals, 57 responded, answered this survey, and 62 professionals. They were asked, tell us about the importance of these topics for your organization. Of course, based on the local needs, what need to the hospital had, without telling them that they pertain to ergonomics. But we just made the question. And look, out of 0, no important, and 5, very important, out of the aspects, all of them except 1 were above 4, which means that for those organizations, those 51 hospitals they answered, these aspects were quite relevant. Like this one. Culture and safety, analysis of incidents, assessment of task, analysis of the teamwork throughout the organization, economic analysis of information systems, but of course applied to healthcare, positions in the surgery room. So what is the message here? We need to apply human factors, but we are not aware at the same time that economics and human factors is one of the disciplines that try to resolve all these problems through an holistic view and then have the corresponding design. Well, it means that the different characters and skills of human beings are not considered.
The second point, when Carlos is going to explain what we're going to do in terms of economy, human factors associated to the healthcare sector, and then again the area of pharmacovigilance. Okay, good afternoon, everybody. It's amazing the attendance, especially the number, of course, not only the number but the variety of people that participate, the industry, hospitals, etc. All of you, I'm sorry if I don't mention you all, but you know each other better than what I can know you. I cannot initiate without thanking you for the space, acknowledging the fact that ISOP has been able to include at the center of the discussion table the topic of discipline, human factors, and ergonomics, obviously understanding all the work done by Brian Edwards, who surely is fully convinced. He said it at the beginning, how he considers that human risks are a motivator, are a guideline for what we're doing. Okay, my participation, my talk, it's related to talk about the human factors discipline as something that it's very determined in the healthcare systems, of course, in some context, as we have the high income countries as England, that it's where I have higher level of relationship, but also the US and many other countries like Germany that probably have a lot of advancement of this. I can't tell you all the development that we've had, but we're going to talk about a couple of things. But to be able, I'm sure that you all know James Reason, that he tells us that we cannot change human conditions, but what we can change are the conditions upon which the humans work, and that's the message. But the human factors and economy tells us that one way to do it. Okay, this is a concept that was established. We have literature that tells us how the human factors, how it's been there since the 80s, since the 90s, especially in the occupational health. And when we talk about the mental burden, etc. And here we can see, and we can therefore we can see the different systems as good part of the healthcare system. Okay, thanks to the publication of Airing It's Human, that I'm sure you know it, we make a lot of emphasis to the role of human factors in the design of healthcare systems, and also as topics in their curricula. Okay, and I wanted to mention this because I wanted to mention that these are the topics that the WHO hides as important. One thing is what's patient safety. That's a central issue that everybody needs to know what we're talking about. But I would like you to see the second and the third one, where they say why to apply human factors and why this is so important for healthcare patient safety. Okay, the WHO talks about the discipline of human factors, and the point 3 is to be able to understand the systems and how these affect the complexity in the care of the patient. These are other areas where Yordan This is what we work upon. Okay, I just wanted to call your attention. This is a topic that's been well established. I'm from Mexico, for example. In Mexico, the patient safety policy was initiated in 2017 in the National Health Plan. And this document that I'm showing, it's in the Health Secretariat plan as and okay, this is an example this is a white paper of the human factors from health and social care. This is a document that's been recently published by the Charter Institute of Human Factors of the UK, where this is a document with where we position what the human factors are, where ergonomy is as part of healthcare. This is a document that you can have access to the Institute webpage. You can download it. As a matter of fact, Jordan and I have worked to be able to translate this into Spanish, and that we can have access to the community that talks this language. Why is this useful, according to this white paper tell us, to use human factor ergonomics in the daily life of the systems? Well, first of all, because we need to think about the different systems. What the industry is doing right now, it's associated to what Evangelina just told us. They are disconnected, of course, because this is a system, and everybody that's part of the system, it's important. We need to take a check of this. And also, when we think about the design of the systems, we need to think in the design. We need to think in everything. Almost everything is designed, and almost everything it's designed. It's to say the chair where you're seated, the microphone, the Jordan's pointer, the screen, everything, it's a design. Everything can be designed, and here the idea is that we need to design it when we're thinking about the people, and of course when we talk about incidents. But I have to say something. It's that a central point. It's not to investigate, it's to design systems that are capable of resisting the characteristics of humans. It's to say we know that human beings are not perfect. We know that, but we also know that human beings want that whatever we do it well. The ergonomy of human factors, we try to help people so that they do whatever it is they have to do well. I'm going to show you a video that says better things than what I do, but it's the same thing.